Human immunodeficiency virus infection, HIV, and acquired immune deficiency syndrome, AIDS, is a sexually transmissible disease that continues to be a serious public health concern, affecting millions of individuals globally, thereby putting the global HIV response at risk. The theme for the commemoration of the 2022 event is Donate Blood to Save a Life. The International Conference on AIDS and STI in Africa Director Luke Amand H. Bodia, while addressing the event, noted that the new infection for AIDS is coming from the youth, with more than 3,000 Ghanaians living with AIDS since 2021. He advised that all preventive mechanisms and tools used in the past years must be brought back to help combat the disease.
You donate your blood, you know your status. This is why we are in this community. You can see all the traditional team, they are here, to support the initiative, with their community people, so that when people are getting tested, at the same time they are donating their blood and they know their status. When they know their status, we can refer them to the center for more information. No, we are in Kolibu here, for example. Kolibu has the greatest center. We send them to Kolibu Center so that they can undergo the system and they can start having their drugs. The latest statistic we have is that we have 23,000 over people, for the statistic of 2021. Over 3,000 people in Ghana here are positive, which is very alarming. It's very, very alarming. And we have noticed that especially the youth, the population that are really infected, the new infection are coming from the youth. This is why we call most of the school around here and most of the university, to give them more information, to enlighten them, so that the prevention should be our tools. We have a lot of tools now in HIV to fight it. And we call that one prevention. We have noticed that we give more attention now to treatment than prevention. We need to come back to the basics, which is prevention. And these people that we have seen before in the year of 80 should come back, so that the youth nowadays should be informed about their status and should be informed how they can use the method, the new method that we have now to inform themselves and to avoid new infection. We take this opportunity to call the government. I know that the government has a lot of priority, they are doing a lot, but we need to call them so that really they can look at the prevention method. The prevention should be the tools. We have a lot of prevention methods, but we should put it at it should reach the youth. The billboard that we used to have on every street before should be a reality. We should bring it back to our midst, so that we are sure that we can suppress new information. That is key for us now. I believe that they are doing a lot of work. Nowadays, we have the social media that are very active. We should use this one to spread the news. Most of our youth now, they have their telephone number, they are in phone, they are in social media every day. We should use also the means to reach them. We are using it, but it's not enough. We need to really increase, we need to scale up the fight by putting more emphasis on prevention.
The acting head of the Southern Zone Blood Center, Dr. Dennis Jonte, highlighted the benefits of blood donation, which includes:
during blood donation, there is health screening. So there's a free benefit of knowing your health status as you undergo the processes of blood donation. And HIV/AIDS is one of the tests that is performed on blood before it is used on patients. So I think the society thought it wise to get involved. Apart from making blood available to patients, donors who come and donate after blood is screened, subsequent donations will get to know what their status is, so that they are able to take the necessary steps.
Mr. Bano, a 66-year-old man who has donated about 86 times, gave some advice to the youth on the need to donate blood regularly.
Anytime you go to donate, they check your HB for you. They check your BP. They check your pulse, your weight. They look whether you have syphilis. HIV/AIDS. Now, all this that they do for you is for free. You don't pay anything. But if you get up, you are not going to donate blood, but you are going to check your HB, you pay. Hep B and C, you pay. Syphilis, you pay. Those of you here, try and become ambassadors. Let the outside world know that blood donation is very, very good. It makes you to comport yourself. It tells you how you should live. You don't go chasing just by heart. No. So I will entreat all of you, if you have not started before, the time to start is what? Now.
World AIDS Day promotes information sharing between local and national authorities, international organizations, and private citizens. It was estimated that more than 33 million individuals had contracted HIV since 1981, when the first instance of AIDS was documented, and over 25 million people have passed away from the illness.